Hi, my name is Rebecca Cisneros, and my capstone presentation is on the public issue of hypertension in Nebraska. I have a personal interest in hypertension because my father-in-law, my husband, and my father all have hypertension and they have associated comorbidities with the disease. And many patients that I see that come into the hospital daily have dangerously high blood pressure, and many of them believe that it's just normal for them to walk through life with it uncontrolled. Also, I see the personal effects that people have with high blood pressure, such as the strokes, diabetes, cognitive issues, vascular issues, and renal disease. Here's some statistics. According to the American Foundation of Health rankings, 37.3% of adult Nebraskans have been diagnosed with hypertension. And according to the Center for Drug Evaluation and Research, only 1 in 4 of these people with high blood pressure actually has it under control. Here are some demographics. Most affected people with hypertension would be our Native Americans, Blacks, Alaskan Natives, men, and adults 65 and older. And according to the CDC, hypertension is called the silent killer because many times no symptoms are actually exhibited, and it can silently damage the body over time. So I'm going to show my educated citizen outcomes. We're going to start with effective communicator. And as an effective communicator, my first example is a nurse leader interview. I prepared for this interview days before it was scheduled by carefully constructing and practicing questions. I researched the current projects and the quality improvement projects that management was working on at the time, just to ask specific questions on these topics. I was professional with my communications, my emails, and I sent out confirmation emails. And also during the interview process, I was really cognizant of the time and adjusted my questions according to the schedule we agreed upon. My lessons that I learned from this experience is before my first semester at NMC, I had very little confidence in my communication abilities. And throughout my 2 years here, I've developed much better communication skills in the way that I utilize technology, research, and writing abilities, and how I express myself. I feel like I'm so much more confident, and I will be academically and professionally successful in whatever avenue I choose. How this applies to my public issue is that being able to effectively communicate education, resources, pharmacy information, and follow-up appointments via verbal communications, translator, and written instructions are all really important in the successful care and discharge of our patients. Effective communication with positive reinforcement can really empower our hypertension patients with the proper education to care for themselves at home to improve their health outcomes. My second experience as an effective communicator is related to the ineffective training of our new float pool staff nurses. While visiting with my manager, we were discussing the training and the struggles of our newly hired mental health float staff nurses. I am one of the only float nurses in the mental health area, and I've been in the role for 8 years. We've hired many staff, and they usually quit soon after orientation. So I suggested training with not only the regular different staffs on the patient care units, but also with myself too, just because there's some differences in the way float pool staff work versus regular staff. We have now implemented a new training program to address these specific float pool activities and skills that are needed to be successful. What I learned is that listening to staff issues, validating their experiences, and finding some solutions to improve our training program were really important interventions to improve how the nurses were feeling in their role. How can I apply this to the issue of hypertension is that we need not only to evaluate our patients' blood pressure, but we really need to listen to their concerns. Asking questions about how these patients are caring for themselves at home is really important. I think that we need to educate our newly diagnosed hypertension patients, just like We would our newly diagnosed diabetic patients with 6 to 12 week outpatient teaching and self-monitoring programs. We need to reassess our patients' understanding of hypertension at each doctor visit and hospitalization, and this requires a lot of communication, education, and re-education to improve the health outcomes for these patients. As an educated citizen, my first reflective individualist situation is assessing what I've learned at NMC that has advanced my skills. I came into the nursing program at NMC with the end goal of becoming a better nurse and having a degree in hand. And my preconceived thoughts of the difference between a BSN prepared nurse and an ADN prepared nurse was that the BSN nurses wrote a lot more papers, and I wasn't wrong, but we do so much more, and I wasn't aware that the BSN nursing degree provided such valuable information in research skills and critical thinking skills, whether they're borrowed from medical, behavioral science, or physical science. I didn't know that the BSN nurses learn about practicing citizenship, communicating effectively, and appreciating others' viewpoints, especially when making very complex care decisions. I gained many needed skills such as critical thinking, assessment skills due to the knowledge from pathophysiology and health assessment. I also increased my research and writing abilities, and this really has carried on into my workplace. The value of the BSN degree is really linked to my ability to implement what I've learned in my nursing practice. And this applies to my public issue by when we equip a patient or when a patient decides to actually equip themselves with education and adopt healthy lifestyle changes, they can change the trajectory of their health. This goes for our patients with hypertension. If they want to improve their health and decrease the adverse effects of hypertension, they can by starting to take their medications as directed, following the diet as prescribed, and exercising to their ability. When patients utilize their resources of education, self-monitoring, and follow-up, and healthy lifestyle choices, they can accomplish their health goals. My second reflective individual situation involved a difficult detox. I was assessing a patient who had previously been cleared in the regular emergency department, and he came to the mental health emergency department for a detox assessment. He was in his mid-30s with a 0.405 ethanol level, chronic alcoholism, renal disease, diabetes, heart failure, and he also had like an implantable cardioverter defibrillator that was just implanted recently. So he was a very unhealthy individual, and unfortunately, we didn't have a detox bed at our detox facility. So the psychiatrist discharged him to go to another facility outside of the hospital that was a much lower level of care. And they didn't have IV abilities and cardiac monitoring. And I advocated for this patient to stay in the hospital, to be admitted to a medical bed on our medical units, which could have potentially, instead of potentially discharging him, which could have been a dangerous situation. What I learned from the situation is that utilizing my critical thinking and assessment abilities to advocate for the safe detox treatment of this patient could have potentially saved his life. And as nurses, we do this every day, constantly reflecting on our assessment and history information, utilizing evidence-based research, and using our critical thinking skills to make really quick decisions that affect our patients' well-being. How this applies to my public issue is uncontrolled hypertension is devastating to the body. So it causes stroke, heart and vessel disease, kidney disease, and diabetes. And we need to analyze our hypertension patients' understanding of the disease process and really work to fill in those gaps where there is knowledge deficits. My first change agent situation is I chose aging partners for my healthcare agency for my population-centered health clinical because of the many services offered to seniors. And one of the very unique services was Aging Partners had UNMC students come bi-weekly to do blood pressure screenings, and they did like some simple lab work and foot care as well. What I did there is I presented a hypertension presentation, did blood pressure screenings, and provided educational resources. What I learned from Aging Partners experience as a change agent is I could see that providing the research-based information to our community can really equip seniors for positive health changes. And many people participated in blood pressure screening. I think there was about 30 people, and they had several of them had dangerously high blood pressure with no awareness of the effects that it had on their health. It is vital today to be a change agent and to advocate for healthy eating and wellness activities in a culture that really prioritizes quick fast foods. How this applies to my public issue is making investments in our community to teach others about hypertension can make an impact on others' health. I believe that with the multiple nursing schools within Lincoln, we can do blood pressure screenings and continue hypertension education like the UNMC students. Utilizing public health nurses from the state department to do periodic hypertension education and blood pressure screenings at the senior service areas can provide an opportunity for seniors to learn. And I and nurses like me can volunteer, or my nurses like myself can volunteer and give approved education about hypertension at aging partners or senior centers to stay connected with this demographic. My second change agent situation is about advocating for a positive workplace culture. While starting a new shift on an inpatient care unit, a nurse from another unit came to the nurse's station just to vent about her preceptee's performance. So she was orienting another nurse. And the person she was precepting was almost done with orientation, and the preceptor was really concerned that she wasn't showing enough interest, and she didn't want to take a full patient load at that time. And I just gently reminded the group, because they were all talking about this orientee, that it isn't the right place to discuss this issue. I myself am a preceptor, as were most of the nurses who were at the nurse's station at that time. And we were taught in our training as preceptors to keep all grievances or corrections or concerns between the person we're training and the manager. The preceptor, who actually is an excellent nurse and preceptor, apologized and expressed frustration and just ended the conversation and discussion altogether. What I learned from that situation as a change agent is that we all can become frustrated at any given time, and we need reminders from each other to do the right thing. And it's important to keep the workplace culture positive and make it a safe place for new staff to ask questions, to grow into being really good and competent nurses. And this situation ties into my public issue because in the hospital, we see the same patients over and over with the same chronic health conditions. It could be COPD, mental health issues, hypertension, and it's very easy to become discouraged with these patients and not provide positive encouragement. Through this experience, I learned that we need to treat each patient like it was their first visit to the hospital. When patients have chronic health conditions, they can feel hopeless to change, but it's our responsibility to continue to provide that education and celebrate their little goals and victories with these patients when they have them. In conclusion, with my knowledge of being an effective communicator, I've learned to properly educate, actively listen, and advocate for patients, including those with hypertension and other diseases, its effects on the body, and the prevention of further complications. I'm proud that I've grown in my public speaking abilities while educating seniors at Victory Park Senior Center. And as a reflective individual, I have learned that I am able to utilize critical thinking and assessment skills to treat and make critical decisions about my care of my patients. I've developed vastly at NMC to provide safe, quality patient care, especially for those who are suffering from hypertension and the comorbidities that can result from uncontrolled hypertension. Lastly, I've learned that serving as a positive change agent is vital by modeling constructive communication and behaviors to promote a healthier work environment. I've learned that initiating small organizational changes for nurses can help with job satisfaction and help develop my advocacy and education with encouraging attitude toward patients and community members with hypertension and other chronic conditions in hope to make an impactful change. And this is the end of my presentation. And here are my references. Thank you for listening.